Compassion Now Network for All, in short, CNN for All, Urbana, and
Bethel House of Refuge, Muhammad, Illinois, presents this week's Breaking News in Wellness and Health.
Hi, I'm Dr. Professor Alex Rema Zachariah, MD, CEO of CNN for All. I was recently the Chief Medical Officer of Provena, now Presence United Samaritan Medical Center in Danville, Illinois in 2008 and 2009. Prior to that, I was the Dean of one of the top medical schools in India, Christian Medical College in India, Ludhiana, India.
I'm Pete Schneider, CEO of Bethel House of Refuge in Muhammad, Illinois. I'm the Pete of Dr. Z and Pete. Doc is over there. Prior to that, I was the executive director at a prison ministry in Rantoul, Illinois. And previous to that, I was owner-operator of my own construction company in the central Illinois area.
Yes.
Please, this is a note, a grandfather. This that we are bringing to you is not medical advice at all. It is information only. Do not change your treatment based on this information, right, Doc?
Yes, this is for your information only. You may mention this to your doctor.
And if you'd like to get in touch with us for more information, you can email us at breakingnews@CNN, the number 4, all, cnnforall.com.
Or you may write to us, Breaking News, CNN for All, P.O. Box 17494, Urbana 61803.
Welcome to Breaking News in Wellness and Health. First on the agenda, women who smoke during pregnancy increase the risk of both obesity and gestational diabetes in their daughters. The study is by Dr. Christina Mattsson, Lund University in Sweden, and colleagues, including Dr. Matthew Longnecker from the National Institute on Environmental Health and Sciences at the U.S. National Institutes of Health, North Carolina, United States of America.
So this is across the ocean.
Yeah.
This research is published in May 2013 in Diabetologia, the Journal of European Association for the Study of Diabetes. Data were retrieved from the Medical Birth Registrar of Sweden for women who are born in 1982, when smoking data were first registered, and more than 80,000 pregnancies were included. Among the daughters studied, 7,300 of them subsequently became obese, and 291 developed gestational diabetes when they themselves were pregnant.
This data show that women exposed to smoking during fetal life are at higher risk of developing gestational diabetes.
So you are not only harming yourself, but
your baby.
Yes.
So, absolutely.
Yes.
All right, here's another solution for obesity.
Yeah.
Gym class reduces probability of obesity, a study finds for the first time. Little is known about the effect of physical education, or PE as we used to call it, on child weight, but a new study from Cornell University finds that increasing the amount of time that elementary school children spend in gym class reduces the possibility of obesity. Go figure, Doc. More exercise, less pork.
Yes, we have got to get them exercise rather than do this.
Yeah, that's exactly
The
right.
study to be published in the Journal of Health Economics represents some of the first evidence of a causal effect of PE on youth obesity. Centers for Disease Control and American Academy of Pediatrics, all of which have advocated increasing the amount of time that elementary school children spend in gym class.
This can't be rocket science, Doc.
Yes.
The researchers found that an additional 60 minutes per week of PE time, enough to bring states without an explicit requirement up to the amount of PE recommended by the CDC,
Yes.
reduces the probability that a fifth grader is obese by 4.8 percentage points.
Yeah, so we have to get...
Exercise, man. Get with it.
And we have to get the kid moving.
Yes, sir. Not just the kids.
Yes.
Timing of cancer radiation therapy may minimize hair loss. Boy, that's an issue.
Yeah.
Discovering that mouse hair has a circadian clock researchers suggest that hair loss in humans might be minimized if these treatments are given late in the day.
In the day, yes. The researchers at the University of Southern California, USC, and the University of California, Irvine, UCI, worked out the precise timing of the hair circadian clock in the mouse. This appears in the early online edition of the Proceedings of the National Academy of Science, PNAS. They found that mice lost 85% of their hair if they received radiation therapy in the morning.
Oh my.
Compared to 17% loss when treatment occurred in the evening.
You think this is going to help bald guys?
Yes.
These findings are particularly exciting because they present a significant step towards developing new radiation therapy protocols that include minimizing the negative side effects on normal tissue, such as hair loss or bone marrow.
Yes, so this would be confirmed in ongoing studies and would be available for advice.
Absolutely. Let's move on. Less sleep is associated with the increased risk of crashes for young drivers.
Right.
A study by Alexandra Martinuk of the George Institute of Global Health in Sydney, Australia, and colleagues suggest less sleep per night is associated with a significant increase in the risk for motor vehicle crashes for young drivers.
Yes. On average, individuals who reported sleeping 6 or fewer hours per night had an increased risk for crash compared with those who reported sleeping more than 6 hours.
Get your 8 hours.
Yes.
Crashes for individuals who had less sleep per night, on average and on weekends, were significantly more likely to occur between 8 p.m. and 6 a.m. Those are tough driving hours, Doug.
Yes, so I'm sure this applies all over the world.
Get your rest before you drive.
That's right.
Okay, we're moving. More information for you. A compound in Mediterranean diet makes cancer cells mortal. New research suggests that a compound abundant in the Mediterranean diet takes away cancer cells' superpower to escape death.
Yes, they don't want to die. And this study in cells led by Ohio State University researchers found that a compound in certain plant-based foods called apigenin could stop breast cancer cells from inhibiting their own growth.
It cuts right through their defense mechanism.
Yes.
Parsley, celery, chamomile tea are the most common sources of
Apigenin.
but it is found in many fruits and vegetables. The research appears in the May 2013 in the online early edition of the Proceeding of the National Academy of Sciences.
Yes.
Apigenin.
Yes, the researchers showed in this work that apigenin binds with an estimated 160 proteins in the human body, suggesting that other nutrients linked to health benefits called nutraceuticals, that's a new term, nutraceuticals might have similar far-reaching effects. In contrast, most pharmaceutical drugs target a single molecule.
Oh, do you think it helps you if you're tongue-tied?
Yes.
This new biomedical research technique has a transformative contribution to nutraceutical research.
Yes, nutraceutical is up and coming.
You betcha. It's
Yes.
good news for us.
Yes.
People who are consistently exposed to both wood smoke and tobacco smoke are at a greater risk for developing chronic obstructive pulmonary disease, COPD, and for experiencing more frequent and severe symptoms of the disease, as well as more severe airflow obstruction than those who are exposed to only one type of smoke. That means campers that smoke are looking for trouble.
Yes, the results of the study will be presented at the American Thoracic Society, ATS, 2013 International Conference in Philadelphia. The researchers learned that 53% of those diagnosed with COPD had both wood and tobacco smoke exposure. Moreover, the prevalence of COPD increased as exposure to wood smoke increased.
Boy, That's a new one.
Yes.
The prevalence of COPD was significantly higher in those who were exposed to both wood and tobacco smoke, and those with both exposures had more symptoms,
Yes.
more severe disease than those who were exposed to only one type of smoke.
Yes. So this is
Yeah,
something.
well, cigarette smokers should take no solace in the fact that they're not campers. You need to get away from that smoking anyway. It's not healthy, right, Doc?
Right.
Prenatal exposure to traffic is associated with respiratory infection in young children. Living near a major roadway during prenatal period is associated with an increased risk of respiratory infection developing in children by the age of 3, according to a new study from researchers in Boston at Massachusetts General Hospital and Beth Israel Deaconess Medical Center.
Yes, and this is important information. The study results will be presented again at the American Thoracic Society 2013 International Conference in Philadelphia. The connection between in utero and early live cigarette smoke exposure and adverse infant respiratory outcomes is well established. But this study shows that proximity to a major roadway during prenatal period is associated with increased risk of subsequent respiratory infection in children.
It means the mother breathing in exhaust creates a problem for the babies.
Yes.
Living in close proximity to a major roadway during pregnancy was associated with an increased risk of respiratory infection in children, linking exposure to traffic with adverse effects on health.
Yes.
My goodness.
Yeah, so this is something that we need to take note of.
Absolutely, Doc.
And so this is, again, connected with our environment.
Last thing up today, air pollution and noise pollution increase cardiovascular risk. Both fine particle air pollution and noise pollution may increase a person's risk of developing cardiovascular disease.
Yes, very interesting sort of correlation.
Man.
This study to be presented again at the American Thoracic Society 2013 conference in Philadelphia. It's by the Research Institute for Environmental Medicine in Germany. The study looked at both these at the same time and found that each form of pollution, both noise and fine particle, was independently associated with subclinical atherosclerosis.
My goodness.
Yes.
To determine the association of the two variables with the cardiovascular risk, the researchers looked at thoracic aortic calcification, TAC, a measure of subclinical atherosclerosis.
So that this finding is based on very solid findings. Yes.
All right, Doc, let's take a break and come back a little bit later.
Yeah,
okay?
thank you for listening to this segment of Breaking News in Wellness and Health.
There are many different types of motor vehicles that bicyclists must share the road with, but special care should be taken when riding on a street that is also a bus route. Bicyclists should ride as far to the right on the road as safe as practical. However, buses are also typically driving in the right lane and are pulling over to the right curb to pick up and drop off passengers. It is important for bicyclists to be aware of the location of buses, ahead of and behind them, so they can be prepared to act accordingly. It is easy to recognize bus stops adjacent to the bike lanes because, similar to intersections, the bike lane lines become dashed along the bus stop, indicating that merging may take place at this point, and to be aware and use caution in this area. However, bus stop locations may not always be so easy to recognize. Champaign-Urbana MTD buses will pick up and drop off passengers at many locations, including mid-block stops and stops that are not always identified with a bus stop sign. If a bus is pulled over to the bike lane or pulled over to the curb, a bicyclist should behave the same as when overtaking a slower moving road user. Scan for traffic, signal, and merge into motor vehicle traffic. Bicyclists should pass at least 3 feet from the bus to ensure that they can be seen in the bus driver's mirror. Never pass a bus on the right side. Bicyclists should pay attention to the bus's rear signal lights. If the bus is picking up and dropping off passengers, both backlights will be flashing. If the bus is getting ready to re-enter the vehicle lane, the left turn signal will be on. If the left turn signal is on, the bicyclist should assume that the bus does not see them and will re-enter the vehicle lane. The bicyclist should slow down and let the bus pull out in front of them. Buses do have blind spots, and operators are trained about them, but it is always best to ride defensively.
Compassion Now Network for All, in short CNN for All, presents Breaking News in Wellness and Health. Hi, I'm Dr. Professor Alex Rayma Zachariah, MD, CEO of Compassion Now Network for All.
And I'm Pete. I'm the Dr. Z and Pete, the CEO of Bethel House of Refuge in Mahomet, Illinois. What we're bringing today is information and not medical advice. Please don't change your treatment regarding this information.
Yes, you may mention this and about this information to your physicians about that, and we bring to you latest breaking news in wellness and health.
If you want to get in touch with us, you can email us at cnnforall.com. Breaking news at cnnforall.com. And notice the 4 is the number 4.
Right. Or you may write to us, Breaking News, cnnforall.org, CNN for All, P.O. Box 17494, Urbana 61803.
All right. Back at Breaking News. Young people who have their first drinking during puberty have higher levels of later drinking in life. Research shows that the earlier the age at which a young man takes his first drink, the greater risk of developing alcohol problems. Thus, age at first drink, AFD, is generally considered a powerful predictor of progression of alcohol-related harm.
The results will be published in the October 2000 issue of Alcoholism, Clinical and Experimental Research, and are currently available at Early View.
College women exceed NIAA drinking guidelines more frequently than college men. In order to avoid harms associated with alcohol consumption, in the 2009 National Institute on Alcohol Abuse and Alcoholism issued guidelines that define low-risk drinking. These guidelines differ significantly for men and women. No more than 4 drinks per day and 14 drinks per week for men, and no more than 3 drinks per day and 7 drinks per week for women.
Yes, the results will be published in the October 2013 issue of Alcoholism, Clinical and Experimental Research, and are currently available at Early View. The study found that female college student drinkers exceeded national drinking guidelines for weekly drinking more frequently than their male counterpart, by exceeding weekly limits more than men and putting themselves at increased risk for experiencing such long-term effects.
If women continue to exceed weekly recommendations over time, it puts them at greater risk for health issues such as liver or heart disease and certain forms of cancer. You got to manage those things. You can't go wild, and that's what's happening on many campuses in the United States.
Yes, and it's interesting that men is sticking to the recommendation and not women.
That's
not the female.
Individuals who drink heavily and smoke may show early aging of the brain. Findings show that alcohol-dependent AD individuals who currently smoke show more problems with memory,
yes,
ability to think quickly and efficiently, and problem-solving skills than those who don't smoke. Effects which seem to become exacerbated with age.
Yes, this, as it goes on, the results, the study from the University of California, San Francisco will be published in October 2013 issue of Alcoholism, Clinical and Experimental Research, and are currently available at Early View. This study provides evidence of greater cognitive difficulties in alcoholics who also smoke, which could offer important insights for treatment programs.
Well, it shows that alcohol and
yes,
smoke combined are
yes,
like brothers that contribute to this type of thing. The study completely supports programs that routinely offer smoking cessation programs to all individuals seeking treatment for alcohol substance abuse disorder.
Yes, we need to make this very special note of this, yes.
You know, a lot of times in AA meetings, there's a lot of smokers.
Yes.
Levels of physical inactivity and obesity are high in children, with fewer than 50% of primary school age boys and fewer than 28% of girls meeting the minimum levels of physical activity required to maintain health. Exergaming.
Yes.
That's this stuff. Using active console video games that track player movement to control the game, e.g. Xbox, Kinect, Wii, has become popular and may provide, Doc, an alternative form of exercise to counteract couch potatoes, sedentary behavior.
Yes, the study, yeah, if you can't beat them, join them.
That's
the
right.
study researchers from the University of Western Australia is scheduled for publication in the Journal of Pediatrics. Researchers studied the effects of exergaming on children. Yes.
The study found that high-intensity exergaming elicited an energy expenditure equivalent to moderate intensity exercise. Low intensity exergaming resulted in an energy expenditure equivalent to low intensity exercise.
Yes.
So you're not going to get away with doing your walking or bike riding,
Yes.
right?
Higher intensity exergaming may be a good form of activity for potatoes, couch potatoes, children to use, gain long-term and sustained health benefits. Nothing like get up
right.
and moving
Get
around.
off of that couch.
Right.
Now listen to this, Doc, about depression. Depression is linked to almost double stroke risk in middle-aged women. Depressed middle-aged women have almost double the risk of having a stroke, according to research published in Stroke Journal of the American Heart Association.
Yes, yes. In a 12-year Australian study of 10,000 women, 47 to 52 years old, researchers at the University of Queensland in Australia found that depressed women had a 2.4 times increased risk
My
of
goodness.
stroke compared to those who weren't depressed.
You know, this may go hand in hand with
Yes.
the divorce rate, too, 50%.
Yes.
This is a first large-scale study in which researchers examined the association between depression and stroke in younger middle-aged women. Similar results could be expected among American and European women.
So
I don't
this-
think you're off the hook over
That's
here.
right. So this needs to be well taken note of.
Right. It's not just a down-under program.
No.
They're down under, but it's not just down under.
Yes.
College students eat more fruits and vegetables and exercise on the days when they communicate with their parents. You know, mom goes, "Are you eating your
Yes.
fruit and vegetables?"
Yes.
According to researchers at Penn State, only a third of college students consumes a diet that is consistent with national recommendation. And in addition, college students' physical activity levels decline from the first semester to their seventh semester. Go figure, huh?
Yeah, that's the pressure of
School.
Yes. The results appear in the May 2013 issue of the Journal of Adolescent Health. The team found that on days when students communicated with their parents for 30 minutes or more, they were 14% more likely to consume fruit and vegetables and 50% more likely to engage in 30 minutes or more of physical activity.
Must be something subliminal going on, Doc.
Yes.
Students' communication with parents may remind students someone really cares about their health and well-being, and that may motivate them to take better care of themselves. Call your mother, call your dad, eat your fruits and vegetables.
Yeah, but I tell you, the parents should call them.
Oh, yeah, that's true.
Not the other way
I'm
around.
calling mine.
Yes.
Work-related stress linked to increased blood fat levels, cardiovascular health risks. Spanish researchers have studied how job stress affects cardiovascular health. The study published May 2013 in the Scandinavian Journal of Public Health was conducted on a sample population of more than 90,000
90,000 workers.
undergoing medical checkup.
Yes, that's not a small
That's
number.
a pretty thorough
Yeah, the workers.
investigation.
Yeah, the workers who stated that they had experienced difficulties in dealing with their job during the previous 12 months. 8.7% of the sample had a higher risk of suffering from dyslipidemia. That means the lipids that are not healthy.
Mm-hmm. The relationship between stress and cardiovascular risk could be changes in our lipid profile. which means higher rates of athermatosis,
Yes.
plaque accumulation, lipids deposit in our arteries. Boy, I'm glad you had that big word, Doc.
Yes.
That's a doctor word.
Yes, that is, yeah. So that's, again, an important correlation.
All right, check this out, Doc.
Yes.
If you're a left-brain thinker, chances are you use your right hand to hold your cell phone up to your right ear. That's what I do, according to a newly published study from Henry Ford Hospital in Detroit.
Yes. The study to appear online in JAMA Otolaryngology.
Oh, man, I'm glad that was you.
Yes, shows a strong correlation between brain dominance and the ear used to listen to a cell phone. More than 70% of the participants held their cell phone up to the ear on the same side as the dominant hand.
Left brain dominant people, who account for about 95% of the population and have their speech and language center located on the left side of the brain, are more likely, Doc, to use their right hand for writing and other everyday tasks.
Yes.
The Henry Ford study reveals most left brain dominant people also use the phone in their right ear.
Yes.
Despite there being no perceived difference in their hearing in the left or the right ear.
So the hearing is the same.
Right. And right brain dominant people are more likely to use their left hand to hold the phone in their left ear.
Yes.
Go figure, Doc.
Yes. So, well, this may look a simple conclusion, but this particular study had definitely confirmed it.
Here we go. We're back to drinking. Men who are heavy drinkers and homeless for long periods of time have 400 times the number of head injuries as a general population, according to a new study by researchers who said they were shocked by their... I'm not shocked. You see them a lot drunk, staggering around.
Yes.
Hitting their head isn't unusual.
The study from St. Michael's Hospital, Toronto, Canada, appears online in Emergency Medicine Journal of May 2013. These men have 170 times as many severe head injuries as the general population and 300 times as many injuries that cause bleeding in the brain.
It really says that homelessness and drinking is more of a crisis than what we thought. In medicine, when one worries, something occurs 2 or 3 times more often in a particular patient group. But to talk about magnitudes of 300 or 400 is absolutely unheard of, Doc.
Yes.
We're in crisis.
Yes, in Canada, about 12 in every 10,000 men have a head injury that might involve a brain injury each year. Among the chronically homeless, the number is 4,800 every year. This needs to be taken note of.
Absolutely.
Yes.
And finally, despite previous studies touting its benefit in moderating gout risk, new research reveals that vitamin C, also known as ascorbic acid, does not reduce uric acid, urate levels, to a clinically significant degree in patients with established gout.
Yeah, this was generally thought that vitamin C helps. The results published in the American College of Rheumatology, ACR, journal Arthritis and Rheumatism, May 2013. Gout is an inflammatory arthritis that causes excruciating pain and swelling triggered by the crystallization of the uric acid within the joints. Estimates from the ACR reports that more than 8.3 million Americans suffer from gout.
Though vitamin C may reduce the risk of developing gout,
Yes.
the study does not support using vitamin C as a therapy to lower uric acid levels in patients with established gout. Well, that's all we got today, Doc. It's good to see you. Thanks for the info.
And thank you for listening.